It's very important for the public to understand that there is not an epidemic of unsafe plastic surgery out there. We do hear a lot about patients who've been injured or who've had less than optimal results when they choose to have elective plastic surgery. And I think there are a bunch of reasons for that. First is that in today's media explosion of information, patients just hear a lot more about things that none of us heard a lot before. And that has to do with all of life, not just plastic surgery. The other aspect is that our population is changing, and appearance, of course, is important to all of us, but in a time when image, whether it's on Facebook or any of the other social media sites, is so important, people are desiring to look as good as they can for as long as they can. So the temptation to go to a practitioner who may not be qualified or in some circumstances unlicensed is stronger than ever. As board-certified plastic surgeons, in addressing many of the consequences that result from improperly performed procedures or unlicensed practitioners injecting things that aren't supposed to be injected into certain areas, it's really difficult for us to ever get the patient back to point one. Training and experience, starting with board certification by the American Board of Plastic Surgery, not one of the other similar sounding boards, is probably the first green flag to look for. Make sure that the doctor or practitioner is affiliated with a local or regional healthcare system that has a good reputation. Because by being part of the system, the doctor has to have had his or her credentials explored and have their practice reviewed by their peers. No one can guarantee a particular result. Board-certified plastic surgeons pride themselves on being able to offer their patients the latest advances in the safest environment possible.